Good morning, everybody from this side of the world. I'm Dr. Temitope Farombi, and I'm a neurologist at the University College Hospital Ibadan. And I work in geriatric center where we have over 20,000 enrollees of older adults, and I'm the only neurologist taking care of neurodegenerative disease there. Also, I'm also the convener of Dementia Not Witchcraft campaign, which was born out of experiences in the clinic and in the community. The essence of this discussion is to be able to enlighten people what dementia is, what it is like in our community in Nigeria and by extension Africa, and also to talk about the cultural beliefs and practice systems and that affects the overall health of someone suffering from dementia. And also we'll be able to, the intervention we've done so far. Witchcraft has been an age-long practices in the world and also in Africa. While the world has moved ahead, Africa still believes so much in the practice of witchcraft. However, it is attached to being evil and not something nice. So like you can see in this first slide, this woman here is tied down by even younger population, younger people that are supposed to protect her. And she's tied down with a chain because they felt she's a witch. Perhaps here she's got symptoms and signs of dementia. So what this is going to be talking about is to be able to enlighten us on the symptoms and signs of dementia, and it's been seen in Africa and in Nigeria. Dementia is a collection of symptoms resulting from disease or injury to the brain. It's a neurodegenerative disease. It's a progressive brain disease that affects, commonly seen in the older adults, and they develop some symptoms. Definitely, when they develop these symptoms, they lose functional capability, and they are dependent on others to live their lives. Like I said, it's a progressive thing, so it doesn't start and get to the end stage immediately. For some, it can stay up to 5 years before you fully developed it, and for some, it can be as long as 10 years. There's a graphic of someone who is about the same age with a normal brain and someone who's got dementia. And this person, someone who got dementia, often have a loss of brain volume, and they won't be able to perform optimally as they should. Of course, we have different types of dementia, and these types, the commonest one is Alzheimer's disease, seen in 60 to 70% of people living with dementia, closely followed by vascular dementia. Then we have frontotemporal dementia and dementia with Lewy body, young onset dementia, and other diseases of the brain that present in form of dementia. What are the major symptoms? The major symptoms of dementia that we see: memory loss, short-term and long-term memory loss. The first that is seen mostly in people is short-term memory loss. They can't recall things that they've done recently, things that they were being told, they can't recall it. And also they begin to have language problems in retrieval of words. And also they have functional disability in terms of executive function, being able to carry out simple mathematics, simple things like operating their phones that they used to, or being able to expend their monies and all that. And as time goes on, they have problem recognizing places, faces, familiar faces. Some would have lived with their spouses for a long time, and they won't be able to recognize person's face. And also their children, and all this can lead to extreme emotional disturbances for them. And that is what actually where the problem is, where there is emotional disturbances. People don't want to live around them. They feel they are being they're irritable, or they are too moody. And when they stay on their own and they don't want to be part of the family in this part of Africa, that's where the problem is.